Well, tonight, a special report straight from the front lines here in Billings. Nurses who do this every day. They see it, they fight it, and they feel it. Some of them even more than others.
It's like going to war. It's like you're going in there knowing that the department's going to be full, that you're going to have to wait for rooms, that there's going to be people coming in that are sick.
It's really hard right now to be a nurse, really hard. It's exhausting.
And working when people are dying and not their families not being able to come in and visit, just horrid.
From long-term care, the dialysis clinic, and the emergency room. All three nurses, all three facing COVID-19 head-on.
Every day we see people that come in and then, 2 weeks later they've passed away.
Brad, Shelley, and Sherry share a lot more than their profession. They're siblings who've been battling COVID-19 on multiple levels.
I found out on the 9th, late on the 9th, I was already at work, that my test was positive.
Sherry works at Canyon Creek Memory Care, the first official coronavirus outbreak in Yellowstone County, infecting dozens of people both inside and outside the facility walls.
Went in the front door and down the stairs where I stayed in quarantine.
Despite immediate precautions and isolation, Sherry's 82-year-old mom, who she lived with and cared for, was already infected.
She was disoriented and confused and starting to get a temperature.
And that was horrible, not to be able to come up and help her, to see my mom for the last time before she left the house. And that was the start of it.
The start of more than 3 months of their most difficult days. Their mom, Darlene Foote, entered the hospital alone. And just 6 days later, John, her husband of 35 years, followed.
They were on the same medical floor and didn't see each other.
With both parents critically ill, all 8 children faced difficult decisions.
We had made the decision. We knew that this was it. She didn't want heroic efforts at all. We knew she wanted to be around us.
There was no way that I was not gonna allow her to come home. I would have done whatever it took, because I was not gonna let my mom die in the hospital by herself.
We are all so grateful for that time that we had.
We could all be the nurse at that point and all be kids at that point, so we shared the duties.
John finally made it out of the hospital. He made it home, but the damage from the virus plagued his body. And as Brad traveled with him to Cincinnati to be cared for by another sibling, John fell asleep for the last time. So after 105 days, this family was left to deal with the loss of both parents.
1 was a lot, but then 2 close together, that was the hardest. And trying to get John to his daughters. We didn't make it. We didn't make it to our final destination. He did, but we didn't.
Telling their story was not an easy choice. There's deep hurt and feelings of guilt.
I feel like it's my fault that they got it. I just do.
It's devastated our family. Like, we've all lost something.
But all of Darlene's and John's children, nurses and not, agree on a motive, a plea for all people to take precautions.
It's like, no, no, this is not going away. It's real. Please, just wear your mask. It's not asking too much.
Humanity is just being kind to other humans. Like, why would you not do one simple thing to protect someone else?
We're all tired and we're all worn out and we all want it to end, but it's not going to. And it's so much easier to be nice and caring. I hope people realize that at some point and make the sacrifices that are needed to get through this.
And shortly after chief photographer Paul Humphrey and I did these interviews, Brad contracted COVID-19. The stress it caused his body landed him in the emergency surgery room and forced him out of work for 3.5 weeks. And even though they've all had COVID, all three of these nurses say they will be getting vaccinated. They say this isn't political, don't take it personal, and help protect other people.